really pleased to be here today. And recognizing that this panel is between Dr. Jones and lunch puts us in a little bit of a hard place, but fortunately it's a fantastic panel, and they've actually already decided to throw caution to the wind, and I'm going to introduce them, and they're going to move into the audience because they want to see each other's presentations. Just one little note is if you leave here today and you're really energized, and I know that Dr. Pollack is going to talk a little bit about health impact assessment, and if you want to learn a little bit more about that, over at the Blaustein School on May 17th, we're going to be having a briefing on a health impact assessment on 2 health impact assessments that we're finishing up, one of which is actually in one of New Jersey's cities that was supported by the Robert Wood Johnson Foundation and the Health Impact Project, where we looked at health outcomes in a New Jersey city related to natural infrastructure associated with trying to address flood mitigation. So if you're interested and you're from New Jersey, let me know and I'll give you the logistics on that. One other little sort of commercial advertisement, I guess, is that earlier in the week I had the opportunity to participate in another session here at Rutgers where we brought in the head of the International Panel on Climate Change, Intergovernmental Panel on Climate Change. And as part of that conversation, there was a really great discussion on impacts of climate change on human security. And really what the focus there is looking at impacts on vulnerable populations and vulnerable places like our cities, where there's already compromised health and conditions that lead in those places to compromised health. And the discussion through the IPCC, but also here in New Jersey, is trying to look at how climate change is sort of viewed as like a tipping point in terms of pushing those existing inequities to an advanced point. So to that extent, we're actually pulling together a number of leaders in public health here in New Jersey on June 3rd to have a mini workshop on climate change and public health impacts in New Jersey. So if you're interested in that, please let me know. Both those events are free and open to the public, and I'm happy to point you to where to register for them. So with those commercial advertisements out of the way, I'm really pleased to be here to moderate this panel on transportation. We have 3 great speakers. They're each going to talk for about 15 minutes, which will leave us some opportunity to answer questions and have a discussion while your bellies might be grumbling a little bit as we're going into lunch. This is a fascinating conversation. Transportation's complicated and complex. I mean, we're talking about things that are associated with equity and access, with issues that are associated with the nature and design of our communities, with issues associated with exposure to toxics and air pollution, and also with opportunities to have access to active transportation and to be physically fit. So it's a complex topic, and we're touching on a little bit of all of that, not necessarily everything today. So I think it's going to be a very challenging discussion, and so I'm happy that we have a little bit of time at the end for conversation. We're going to go in the order that's in your agenda, and I'm not going to go through the bios, but I'm very pleased that we've got Dr. Norman Garrick, who is from the University of Connecticut, Dr. Ralph Buehler, who is from Virginia Tech, and Dr. Keisha Pollack from Johns Hopkins. And just a quick shout out to Keisha, who's been very helpful to us here at Rutgers as we've been doing some work associated with health and all policies and health impact assessment, and we've appreciated her guidance and mentoring. So with that, I'm going to turn it over to Dr. Garrick, and I know that our other panelists are going to slide into some seats in the front. Thank you.
Good morning. It's really wonderful to be here. I have really enjoyed the conversation this morning. It's a unusual forum for me to be presenting in, but I'm really pleased to be here because there's so much commonality in terms of what we are speaking about here. In fact, I was really struck by 2 things that were said this morning. So Dr. Jones talked about the miasma, the cloud that we pretend that racism is about when it's really about this, a system. And Dr. Kawati talked about policies that are not ordained or are, that are not, what was the term used, I guess? Ordained or, should need my glasses. What is that? Inevitable. Or inevitable, yes. It's really important. Those two themes are really important when it comes to transportation. Because often we treat transportation as if things are just going to happen, traffic is going to grow, so we need to level our cities to accommodate traffic. That is how we do transportation planning. And that's really what I want to talk about today, how those things came about and what are the impacts on cities of those types of policies. So I wanted to start out with this map. This could well be Trenton or Camden. It's not. It's the city of Rochester in New York. And this is Rochester in 1898. In 1951, this city had almost exactly the same structure. So for almost 100 years, this city operated under a certain set of principles. It behaved in a certain way with these structures, with the ways of getting around, etc. In the early 60s, something happened. And this is what the city looked like in 1969. This is really amazing. When you look at this and see what we did to Rochester and to almost every city in the country, you look at this plan and you realize that this is not a healthy city. Just looking at that map, you can tell it's not healthy financially. The people are not healthy. It's using so much resources. Everything is wrong with this place. But these are the types of places that we built, and yet we pretend that what has happened to our cities was, it just happened. It was not brought about due to the actions of transportation planners and urban planners. So 1969, 2012, almost the exact same structure. So the city changed from one way of operating prior to 1950s to a totally different way, a totally different type of city. So 2 days ago, we celebrated the 100-year birth of Jane Jacobs. When she was 88, she wrote this book. And I think it's not as well known as some of her other books, but she writes in this book that one of the things that happens when we move towards a dark age, when as a society we are decaying, is that we forget there is a collective amnesia. And that's really what is going on in terms of transportation, in terms of how we treat our cities. We have forgotten how they operated prior to all the changes we made in the 1950s. And we really need ways of understanding how cities operated back then so that we can start to plot a different fate for our cities. And really, that's one of the things that I try to do in my research. And I'm going to talk a little bit about that, but before we go there, I want to take you to a different place. So this is my home country of Jamaica, and this is what people think of when they think of Jamaica. But I'm actually from this place. This is the city of Kingston on the other side of the island. And I want to talk about Kingston because Kingston is really interesting. It's a city that is not particularly poor by world standard. It's not rich either. But it's really illustrative of a lot that has happened in terms of transportation planning and how transportation planning affects people's lives. So Kingston was where I learned to love cities, where I learned to be an urbanist. Growing up on this street after high school, I would hang out on King Street in Kingston, Jamaica, a well-built town, a well-built city. In 2004, I was a Fulbright scholar. I went back to Jamaica, and I thought I was going back to Kingston, but this is what I went back to instead. The new Kingston, very different, a very different place that was built on a different premise, where these school kids are almost as if they're in prison. No space allotted to students. But this is the place that we in Jamaica look to as the future, as the present and the future. And we have essentially abandoned downtown Kingston. But while I was in Kingston in 2004, I really learned some really important lessons that I had understood from a theoretical point of view. But living in Kingston, living in this relatively poor city without a car, it really brought to mind some lessons. And one of the lessons was the relationship between transportation and the economy. How the type of infrastructure that we build affects the type of economy that can take root in that culture. Like in downtown, where I was able to observe this kind of activity that would not be possible in the New Kingston, where the infrastructure did not support that. All over New Kingston, for 3 months in Kingston, I didn't have a car, so I would walk through this market every day. I would buy my food in the market. And for the last month I was in Kingston, I got a car. And I realized all of a sudden I was in a different economy. I was in the import economy. So, you know, those kinds of connections, those kind of fundamental relationship between transportation and economy and how people live, I just didn't understand really viscerally until I had to experience it in Jamaica. And then I understood also why policies around transportation are so difficult. I remember a Christmas Day discussion at the statue with a friend was explaining to me why he had to dress well. And he was telling me that he had to dress well because he didn't have a car. And in Jamaica, if you don't have a car, that your clothes is what you put out to the public. And so, you know, that sense of well-being was tied up in terms of transportation, in terms of how we did transportation. Spanish Town, the town that I actually grew up in, a suburb of Kingston, beautiful town that was built around in the 1500s. It's become a suburb of Kingston, essentially falling into the mud. But I went back in 2004, and this is what they had done to my hometown. They had turned it into a couplet, a sewer, to bring traffic in and out of Kingston. The whole town was a one-way couplet to force traffic. And it made me realize the extent to which would go to move traffic. It's not unlike what we do here, but the results are so evident in Jamaica that it's just shocking. So when I came back, it really informed a lot of my research and having questions about some of the sacred cows in research. And one of the subjects we started looking at was this issue of the street networks and how that might or might not impact life in cities, the former cities, etc. And this is a really interesting thing because it's something that never gets discussed in engineering school. But what has happened is, over the years, the type of places that we build have changed. Prior to the 1950s, more or less, this is what we built. After the 1950s, this is what we started building. And one fascinating thing for me is how this change came about. The Federal Housing Authority, which is you might ring a bell for you. I mean, this agency had a lot of impact on lots of what we're talking about here. But who would have guessed that it would have an impact in terms of the very way that we build cities? In 1938, they put out these pamphlets, and they were not very subtle. Bad, good, bad, good. So the changes that we saw was informed by the Federal Housing Authority, our nation's capital. This is what they had to say about it. They said the grid layout was monotonous, had little character, uneconomical, and unsafe. That was our national capital they were talking about. In comparison, they said that, I guess the reverse of that was that this place, and Dr. Jones might recognize this, Atlanta, Georgia, flying into the airport. I guess this place was not monotonous, had lots of character, was economical and safe. So one of the things we decided to do was to actually look into some of these claims, and we did some research looking at these cities in California, and we came up with results that actually was the opposite of these claims about what cities were like. We also looked at health outcomes, and I'm going to go through this fairly quickly. And we found that depending on the type of places, we had higher outcomes for obesity, diabetics, blood pressure, etc. This got a lot of press. All the press was about, you can guess, fat. These are some of the headlines. Called the fat. Do we look fat in these suburbs? Just living close to Walmart makes you fat. So another line of research that we looked at was parking, how we dismantled our cities for parking. This is from Buffalo. That's the same place in Buffalo. We went about mapping the changes in these cities. This is Hartford, Connecticut in 1957, Hartford, Connecticut in 2009. In 1999, the city decided that it needed to develop an action plan. This is a city with all of this parking. The action plan was to build more parking. This is what the numbers look like. 16,000, 47,000. A city that lost 50% of its population, lost all of its retail, and it tripled the amount of parking in that city. So my time is short. One of the things that happened with cities, it wasn't just the change in quantity, but in also quality. So this is what Hartford went from in terms of the urban fabric, and we compared it to Cambridge. And one of the interesting things for me, and I'd really not paid much attention to this, is how we changed the ecology of the economy in these places. So we went from places that were vibrant, mixed economy to places that were basically monocultures, were really dead places economically, where things couldn't thrive, compared to a city like Cambridge. I'll get on with it. I was too ambitious. A few years ago, we decided on to try to prove cause and effect using a method that was used in the 1960s for looking at the relationship between smoking, tobacco smoking, and cancer. We applied the methodology to parking and driving in cities, a method that is attributed to Dr. Bradford Hill in the UK. And the conclusion was basically that parking, which is a no-brainer, but in transportation and we supposedly need science. So I love this graph, and I won't get to discuss it very well, but this shows part of the implication of what we did in terms of transportation planning. The amount of driving in America, and a lot of what we're talking here relates to this graph. The destruction of our cities, the use of resources, et cetera, et cetera, et cetera. And compared to where other countries are, this is where Canada is on a per capita basis. This is Germany, and this is Japan. So one of the things we say is that this is inevitable. There was nothing inevitable about this. This was about how we plan transportation, how we built infrastructure, etc. Jane Jacobs had an interesting take on this, and her take is that, and I agree with her, that transportation planning is an anti-science, masquerading as a science it betrayed. Enrique Peñalosa, a few years ago, he's the current mayor of Bogota. A few years ago, I had the opportunity to take him to Jamaica. He says that sidewalks and cycle tracks are powerful symbols of democracy. They show that a person on a bicycle is as important as a person in a car. And I had reflect on that when I look at this picture. This is King Street, Jamaica, around 1920. It's about 80 years after slavery in Jamaica. Slavery ended in 1838 in Jamaica. This is the kind of public realm that we had in Jamaica in the 1920s. And you think about where we are now, and you realize that we have not advanced. That we are actually going back in terms of equity, in terms of how we treat our people, certainly from a transportation point of view, but certainly when we think about transportation and how it relates to health, in terms of people's pocketbook, in terms of illness, etc. Yeah. It's all yours.
It's amazing how quickly 15 minutes go.
Good morning. Thank you very much for having me. My presentation focuses on how policies can encourage walking and cycling, so hopefully dial back a little bit of the things that Norman just presented. I will also refer to walking and cycling together as active travel during this presentation, so don't get confused by these. To me, they're the same. A lot of what you see here we summarized in a active living research brief that just came out in January together with colleagues from Switzerland and from Canada. It's called Moving Toward Active Transportation, How Policies Can Encourage Walking and Cycling. In transportation, the connection to public health and physical activity occurs typically in these three main areas. One is the air quality, the other one is safety, traffic safety, injuries, fatalities, and the third one, that's the focus of this talk, is active travel and physical activity. And we know that a lack of physical activity is a major risk factor. We also know that walking and cycling for daily trips, just for getting around, can give us physical activity and help populations reach recommended daily levels of physical activity. On the other hand, driving is a sedentary activity and is a major source of physical inactivity and is associated with overweight and obesity, etc. Communities are promoting walking and cycling not just for the health outcomes but also for environmental outcomes, because walking and cycling are equitable, they are financially affordable, virtually everyone. They are physically possible by most people. They're economical for cities, but also for people in terms of cost. And they may take more time, but they give you physical activity. However, as Norman showed, over the last 100 years, we've done a good job in moving from a walkable and bikeable city to a city that's centered around cars. These are two screenshots. One is from a movie about San Francisco right before the earthquake, and the other one is from General Motors in the 1930s, how they envisioned America to look like, and they were not that far off. Either they implemented their dreams or they were just good at predicting. And what's important also to know is what Norman said, many of the things that he talked about, like the parking standards and the separation of land uses, etc., these are hardwired in government regulations. If you build something, you have to build car parking. Land uses are separated so that trip distances are far and may not be walkable or may not be bikeable. We use sales taxes and property taxes to build transport infrastructure, but don't charge enough of the price of driving as driving would actually cost. So driving has been subsidized for nearly 100 years now, and the result is here. This shows you the share of daily trips for getting around by car, cycling, walking, and public transport for various countries, and all the way towards me, the largest bar, 86% in black there, that's driving for the US. Almost 90% of trips are in a car, and then you have the 2% on public transport, 1% on a bicycle, and 11% on foot. They can compare to other wealthy Western countries and see that they have more of walking, cycling, and public transport as a percentage of their trips. Some of you may think, well, that's related to trip distances. Trips are just much longer in the US, and that is partially correct, but about 30% of trips are shorter than a mile, 40% of trips are shorter than 2 miles, and even if we look at these shorter trip distances and at the share of trips made on foot And by bicycle, the US, all the way towards me, has lower shares even for short trips compared to other Western European countries. So and that's where the potential lies to walk and to cycle. You won't walk from New York to LA, but you may walk a shorter distance. And these are the trips we're looking at. We also didn't just look at differences in trip distances, but also at differences in active travel within the US. We used the 2001-2009 National Household Travel Surveys to look at trends in walking and cycling. And we found that active travel declined among children, seniors, and women. There were increases in reaching 30 minutes of walking a day for men, the mid-age group, the employed, the well-educated, and people without a car. The prevalence of reaching 30 minutes of walking a day was higher among Hispanics, African Americans, and Asians than among whites. But on the other hand, the prevalence of cycling 30 minutes a day was higher among whites, the well-educated, and for children. So clearly, policies have to be implemented to make walking and cycling attractive for everyone. Another important determinant of walking and cycling is perceived and actual safety. If you think something's not safe, you will not do it. And walking and cycling, as this graph shows, as the rate of cyclists and pedestrians killed per kilometer walked, for the US, these are the high bars, all the way on the left side here, on your right side, shows that walking per kilometer and cycling per kilometer is about 5 times more dangerous, the likelihood to get killed in the US than it is in the Netherlands or in Denmark. So there's big room for improvement. Luckily, increasing walking and cycling may have the potential to also reduce the risk. We find in research a phenomenon called safety in numbers. And this is here demonstrated using the city of Portland, Oregon. What you see in the orange bars there are the cyclists they count every year crossing a key bridge across the Willamette River there, and that has been going up. At the same time, the crashes reported, it's the blue dots here, have been stable, maybe a little bit increasing. But if you look at the rate, at the risk rate for these crashes, the rate has been reducing. So there is safety in numbers in active travel. In the following, I will take you through a couple of policies that can be used to encourage more walking and cycling for everyone while improving the safety. And that means undoing many of the policies that Norman talked about. And before you say, well, it's not possible, I'll show you a couple of examples, not as extreme as the things that Norman showed, but where this was possible. This is a town in Germany. There is a fountain in the 1950s. You see a trolley, you see bicycles. And then by the 1970s or 1960s, there's the fountain. They went the same way most US cities went. Urban renewal, new buildings, widening streets, cars, pedestrians, and bikes pushed to the side, going the same direction as Norman described. Not as extreme as Norman showed, but going the same direction. However, because of a policy change, is the fountain again. By 2000, this is a street that's reserved for pedestrians and bicyclists. Drivers can come in at the off hours, also for deliveries, or they can drive through very slowly. One more example of these, again, a bridge. Again, a town in Germany, 200,000 inhabitants, 1950s, you see a trolley running over the bridge, a couple of cars. By the 1960s, a bridge for automobiles. The trolley is gone. It was the mode of the past. Today, it's a bridge for bicycles. And pedestrians walk on the side. You can't see that in this shot. But so again, you have these policy changes or these priority changes in policies. One of the policies implemented by walking-friendly cities is traffic calming. That's the city of Vienna in Austria. And all what you see in the dark green, the blue, and the pink color are areas where drivers can only go 30 kilometers per hour. That's 20 miles per hour. The light green are wooded areas or parkland, and then you see there are only very few areas that are not traffic calmed. And actually 80% of all roads in Vienna are traffic calmed. Drivers have to go very slow. Traffic calming can take many different forms. I just picked out a couple just to show and also show a little bit of change in mindset. This is a street. When the car turns left or right, they have to mount onto the sidewalk and cross over into the street. So it's not the pedestrian coming down crossing the street, but it's the car actually crossing the pedestrian's area, so being a guest in the pedestrian space. You can also bring the curbs of the sidewalks closer together, narrowing the crossing distance for pedestrians and making the turn angle for cars steeper, so cars are slower when they are turning there. You also see here is this is a one-way street for cars, but a two-way street for bicycles. They also took car parking out and put bicycle parking in. The ultimate form of traffic calming, cars cannot go through there, what you see there at the bottom, but bikes and pedestrians can sneak through and have a shorter distance and easier access. Traffic calming is not only important for the convenience of walking and cycling, but also for its safety. Speed matters. This graph shows you the likelihood of fatal injury when a pedestrian is hit by a vehicle. And once you have 30 kilometers per hour, this starts increasing exponentially. So 20 miles per hour, that's the 30-kilometer mark, keeps the risk much, much lower. At the same time, if you go more slowly, you will likely not hit someone. You can avoid them. That's a graph my colleague Bob Schneider from the University of Wisconsin-Milwaukee showed me last week, actually. It shows you the stopping distance based on speed. And stopping distance when you're driving is a mixture of your thinking distance, because you have to see that there's somebody you have to stop for, and the actual braking distance. And what you see here on top, where you have the 20 miles per hour, you only have 40 feet to stop. Once you go 30 miles per hour, it's 75 feet, and so on and so forth. So traffic calming and reducing speeds is key. Also, symbolically, this shows you a slide of the 1960s again, the cars even encroaching on the sidewalks, and then today, as a traffic calmed street, a street given back to the residents to be outdoors, to sit, to have trees, etc. In the US, we see some of these developments mainly on the West Coast, in Seattle or Portland, Oregon, where they have neighborhood greenways. These are residential streets with low volumes of car travel. They're traffic calmed, and they try to prioritize bicycles and pedestrians and give them amenities to do that. Also, some US cities have implemented these pedestrian malls where cars are banned. There are not that many, but there are a couple of examples from Charlottesville or from Boulder, Colorado. In European cities, they are relaxing this idea of traffic calming with these shared spaces where pedestrians, cyclists, and cars are sharing the same space. They're doing away with the sidewalk. Cars are allowed to go 20 kilometers per hour. That's about 14 miles. But they have to yield to pedestrians and cyclists. And so, in effect, cars are actually going walking speed. I tried to bring you a video of this that I made, but it wouldn't run on these different computers. On the cycling side, we already have seen many US cities experiencing a cycling boom. Between the 1990s and the 2000s, that's the share of workers regularly commuting by bike in these various cities. And most of these cities have implemented networks of bike paths and lanes and have increased those networks. There are many different kinds of bike paths and lanes. I just brought you one that symbolizes the entire US. This is the US Capitol. In the background, you have this buffered bike lanes, so white paint on the street with these buffers that separate the cyclists more from automobiles. And Washington, D.C. has increased, as many US cities, its supply of bike paths and bike lanes. You see the blue lines and brown lines on your right, on your left. That's from in the year 2000. In the year 2008 to 2012, you see the right with the many more blue lines. That's the bike lanes, and the brown lines there. The color in the background shows you the regular bike commuters. However, most US cities have not achieved a network of bike facilities. This is the city of Berlin in Germany, and what you see here is not the roadway network, but it's the network of bike paths and bike lanes. And on top of that, they have traffic calm most of the neighborhood streets, meaning you can cycle from A to B in this city without cycling with fast-moving, heavy car traffic. You always have your separate space if there's a lot of car traffic, or you share the road in traffic-calmed neighborhoods. And of course, there are a couple of these facilities and a couple of the signs. I like the sign in the center that means walking speed. You don't even need to speak German to understand that that is the walking speed sign. Training is important. In Germany, the Netherlands, and Denmark, children participate in cycling courses in school. And they practice on little parkours, and then police take them out and show them how to cycle in traffic. And sort of proud to report, because we live outside of DC, in Washington, DC, every second grader since this year is getting bike training in school. So there are some practices that are being transferred. Of course, training motorists is very important. What are the rights of cyclists? What are the rights of pedestrians? How do I not hit them? Are they even there legally? I got my driver's license, my US license, in New Jersey, and I did not hear about pedestrians and cyclists on my exams there. So training motorists is also important. The last policy I want to talk about today are trip distances, because if trip distances are too long and not bikeable and walkable, people will not walk or cycle. This is the small German city, 200,000 of Freiburg, and they built 2 new neighborhoods, actually brownfield redevelopments of a sewage farm and a former military barracks for 5,000 and 12,000 inhabitants. They built them around a light rail extension, and the main street, the light rail is in the focus. There are only small car streets, as you see on the lower right, and then all the neighborhood streets are traffic calmed, so cars can only go either walking speed or 30 kilometers per hour. In one of those neighborhoods, as you see in the upper left, you cannot even park permanently. You can drive there to load and unload, but you have to park in a parking garage at the edge of the development. So getting to your car is always taking longer than getting to transit. In the US, there are a couple of examples. This is one that's right close to where we are in Arlington, Virginia, where they, instead of building a Metrorail line in the median, that's the purple line, of Route 66, they put it underneath Arlington County and changed the land uses to make it walkable around those. And they have transformed an ailing suburban corridor into a more high-density walkable area. The problem is that this is so popular that there are all sorts of equity issues because housing prices are shooting up so much. In conclusion, cycling and walking are sustainable means of getting around our cities. They are environmental, social, economic, but also big health benefits. Walking and cycling for daily trips can help big parts of the population achieve recommended daily physical activity levels. There are lots of daily trips that are short enough to be made on bike and foot, and many cities are already implementing coordinated packages of these policies that promote walking and cycling. And with that, I stop, and thank you.
Good afternoon, everyone. Thank you for replying. I appreciate that. My colleagues set me up very nicely. They laid out some important issues we need to think about with transportation planning and policies, and what I'm going to do in my limited time today is talk about how we can actually operationalize this. So I'm going to talk about efforts around the country to actually promote healthy and equitable transportation policies and with a strategy being used. I'm not going to spend a lot of time on social determinants of health. Dr. Jones did that for us. But I just want to show this sentence from Dr. Richard Jackson that says, "We have forgotten that much of our health is dictated by where we live, what surrounds us all the time." So when we think about social determinants of health, we think about how where we live, learn, work, play, pray, all affect our health outcomes, all affect the risk factors that govern whether or not we are healthy. And why that's important, as a health person, we see this as an important challenge because many daily decisions that are made that affect our health occur in sectors that are not the health sector. So decisions made in housing, energy, education, transportation, employment, all have significant health implications that oftentimes go unrecognized. So how do we think about these unintended consequences for health? Well, many of you, I'm sure, have heard of Health in All Policies, or HiAP is the acronym. And this is a collaborative approach to improving the health of all people by incorporating health considerations into decision-making in a variety of sectors. I won't spend a lot of time on HiAP, but I want you to know that there are 5 key elements. The state of California actually has a HiAP, a Health in All Policies task force. Former Governor Schwarzenegger actually created a policy that actually created this Health in All Policies task force, and it's a way that decision-making occurs at the state. And here are sort of the 5 key elements. HiAP policies promote health and equity. They support intersectoral collaborations. They also create co-benefits for multiple partners. So it's not just health people saying, do what we say. It's saying, how can we both recognize the benefits of efforts that are good for health and good for another sector? They all involve engaging stakeholders and creating structural change. So this is a systems change. This isn't just one decision. It's how do we change the system to incorporate health considerations. And there are various ways to do health in all policies, and one way I'm going to talk about is health impact assessments. So if you've never heard of health impact assessments, HIA, here's the formal decision. HIA is a structured process. It's not a single study, but it's a process that uses a variety of data, various methods, professional expertise, and stakeholder input to determine the potential positive and negative health considerations of decisions that are being made. So this is an evaluation. It's not after the decision is made. It's before the decision is made. We say to decision makers, wait a second, before you make that decision, here's how health can be negatively affected, and here's how health can be positively affected. Ultimately, our goal is to develop pragmatic recommendations that are based on the evidence, the collective evidence we've collected, in order to minimize those adverse health impacts and optimize the beneficial ones. So in short, the key points are that HIAs are generally conducted on a specific decision. So a policymaker, for example, has a decision around a transportation issue. So we might conduct a health impact assessment on that transportation decision. HIAs use a broad analytic framework. So many HIAs involve qualitative methods, quantitative methods, systematic literature reviews, etc. Collaboration with stakeholders is key. I can't go to a transportation engineer and say, here's how you make your decision. We need to work together across sectors to understand the processes and the politics in order to figure out how we can feasibly include health into decision making. This isn't an academic exercise. HIAs should be pragmatic and focused on solutions, generating recommendations that can be implemented. And HIAs address health equity. And it's important, and I'm going to briefly show you how HIAs can do that. And one of the ways it does that is that HIAs address those social determinants of health. So again, we're thinking more upstream. We're thinking more about those root causes of decisions. And so we're asking ourselves, how does a proposed project, plan, or policy affect a variety of determinants of health? I circled transportation there, but we can easily apply an HIA to any other sector. I just finished working on one around housing. We're in the middle of working on an HIA around education policy. And the goal is to say, well, how might this decision affect health? For those of you who are unfamiliar with HIAs, the field has been growing. I'm going to show you two maps. This one was based on data collected from a paper written by Andy Dannenberg and colleagues, published in 2007, looking at HIAs that have been completed to date. So you see it's sort of growing, a lot of activity in California where the thing we call the first HIA was conducted. And this is where we are, or where we were in February 2016. And actually today there's over 400 HIAs that we know of that have been either completed or in process. And that also includes federal HIAs, which mean HIAs on decisions being made by our federal government. And so we're seeing growth in the number of HIAs. Again, California continues to do a lot of work here, and I will provide you with the resource at the end that actually there's a searchable map that you can click on to the state and find HIAs that have been conducted to actually learn more about them. So people always say, Keisha, this sounds great, but what difference does it make? So we've done some research, and I say we, I have the pleasure of being a consultant with the Health Impact Project, which is a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust. And at the Health Impact Project and with other colleagues in the field, there's been several evaluations conducted. And here's just a few snippets of comments from policymakers talking about the value of HIA, saying the HIA provided evidence to neutralize conflict, or really can help them win because the concerns have been addressed up front, or reveals gaps in the data, or helps provide a way to guide limited resources to provide the greatest benefits to people. Because this health impact assessment is saying, if this decision goes forward, what's going to happen to health? How might health disparities be affected? What are the equity issues we need to think about? And again, we're using that to inform recommendations to help mitigate those negative health effects. That map I showed earlier with about 400 HIAs or so have addressed a variety of topics, mostly in the built environment. Here's transportation, and I'll talk about transportation specifically now. For those of you who are familiar with Massachusetts, there is legislation supporting the practice of HIA around transportation decisions. So in 2009, in Massachusetts, there was this landmark transportation reform legislation that created the Healthy Transportation Compact. And if you look at that legislation, the compact is actually co-chaired by the Secretary of Transportation and the Secretary of Health for the state. And in that legislation, it actually says that they have to implement health impact assessments for planners, transportation administrators, developers, et cetera, to determine the effect of transportation projects on health and on vulnerable populations. So looking at the impacts on health, the potential impacts on health and health equity, and providing ways to help reduce those negative effects. The specific guidance around implementation of this is still being developed, and there are certainly funding challenges in terms of lack of resources to fully implement this. But I will say this was landmark for the field of health impact assessment, and really the first time we saw HIA legislation supporting a whole sector, or decisions around a whole sector. There was a recent paper published, recent in 2014, looking at all transportation HIAs to say, let's take a look at what the field has said around health impact assessments applied to transportation decisions and what can we learn from them. So from 2004 to 2013, there were 73 HIAs completed on transportation decisions. And here's just a little bit of a summary about who's making those decisions. Those decisions have addressed a variety of topics, including new transit stations, walking trails, policies even around speed limits and complete streets, all with the goal of saying, let's get health to be considered in these decisions that are being made. They looked at a variety of health impacts ranging from physical activity, so saying if this decision goes forward, how might physical activity be positively affected or negatively affected? Injury, social cohesion, etc. And if you look at the outcomes of some of these HIAs, we can see direct changes, direct impacts, saying the decision actually was changed. So a proposed decision on paper was actually changed to better include health. We also see it, and I think this is more common, a number of indirect effects. So where you see a change in awareness around social determinants of health. I work with the transportation engineer who now talks, every time a decision comes up, we're in the room, she says, should we do a HIA here? Should we think about health here? Those are the kinds of effects that we can see happen because of those collaborations, because of bringing the health department together with transportation planners, with planners from the planning department, and we're working collaboratively across sectors. And from that paper by Dannenberg and also from some of my work, I think these are the lessons that we have really learned about thinking of including health in transportation decisions. Number one, collaboration is key. Again, we speak a different language, there's different timelines, there's different political and technical sensitivities that we need to understand, we being transportation people and public health people. We also need to understand the differences in culture, practices, and authority in order to effectively include health considerations in transportation decisions, understanding the timelines and the demands and language and terminology. And I think at the end of the day, what we really need to do and what we can see is that when we identify those synergies, when we identify the added value of working together, we see impacts. And so we can't have our colleagues just thinking about HIA as another bureaucratic requirement, which many do. But what is the added value? What are the co-benefits of this process? And finally, I'll say, I teach HIA, I have a class on this, I do a lot of HIAs, but it's not always the right tool. There are many ways to do health in all policies, many ways to get health into the decision process, and I didn't have time today to talk about how we decide if HIA is the right tool, but it's not always the right tool. But I wanted to talk about it today in my time. So here are just some resources as I wrap up. I'll direct you to the Health Impact Project website at healthimpactproject.org, where you can find that map I mentioned and search the map by sectors or by states or by decisions to see how health has been included in various decisions. And here's my contact information. I'll leave this up here for a second. I have to leave at lunch, unfortunately, to head back to Baltimore to catch a flight. But if you have any questions for me, feel free to call me or shoot me an email, and happy to talk further about this. So thank you very much, and I think I finished on time.
So Norman and Ralph are coming up too. So we have just a couple minutes for some questions. When we get started, we have a microphone. But they're live streaming.
Hi, I have a question for all three of you, actually, but I guess primarily for Ralph, about some of the ways we can improve our transportation systems. I didn't hear anybody talk about folks with limited physical mobility, and I think especially when we're talking about the wonderful activities of walking and cycling, like that's amazing. But not everybody can walk and not everybody can cycle. And so what kinds of changes do you see happening, or what kind of planning changes have you seen to help accommodate everybody?
So there are a couple of, I think, different differentiations. One is, so the things I showed, like these pedestrian zones, for example, So people who cannot walk or cannot cycle, they are allowed to drive into those. They have to drive very slowly if they can drive, or they can be driven in there if they have to reach those destinations. Then there are people who may be able to walk or cycle but may need special assistance doing so. For example, there can be special bicycles that have 3 wheels for balance, and they exist. There are other issues with uneven surfaces on sidewalks. There are also issues with, you see that now in the US because it's in the regulations that you have to, the curb has to come down before you can cross a roadway. So these are all different considerations at different levels. Also, if you have cobblestones, which are very nice, pushing a wheelchair or something on cobblestones is not easy and not very comfortable. So these are many things that may look very nice, but can be actually very difficult. Another issue is for people with some sight impairment, you may have nice trees, but the shade of the trees may actually make it even harder to see, or the sun coming through the leaves. So there are different issues for different groups, and for some there are good solutions, for others I haven't seen that great solution.
And I just want to add, there are several health impact assessments that have been conducted that look at the potential for differential health effects for folks with disabilities, for example. And so particularly around built environment ones, and you'll see specific projected analysis and health effects. Clearly an important issue for health equity that is included in health impact assessments.
Oh, I have a question.
Okay.
So my name is Rosemary Ndubuizu, a graduate assistant with the CRE. I actually have a question that may be for the first 2 panelists. It was great, the second panelist brought up the DC, which I'm familiar with as well. So the question that I have is around the intersections of race, transportation, real estate, government subsidy, as well as disinvested cities that are now becoming revitalized, right? So I'm very familiar with DC, and I recall when my organization that I'm a part of actually had a bike shop back in the 90s, pre-bike lanes. Now bike lanes are, as you mentioned, everywhere for the most part, especially in the gentrified neighborhoods. So given that the city is trying to invest and become cyclist friendly, there's also this need to recruit a tax-based class that can pay back the subsidies that they're putting to make sure all these bike lanes and different things like that are there. So I'm curious whether or not, and on top of that, there's the other element that I think Nyoyo Kawate brought up around the carceral dimension that comes up with this gentrification and this pursuit of gentrification and recruit the tax-based, quote unquote, or the desirable consumer who will then be able to have this fun, Jane Jacobs sometimes considered community. So I'm wondering if you guys can talk a little bit about that a little bit more, and I'm sure the next panelist will touch on that, but part of this is, I'm also wondering, how does this deal with questions of race as well? And the fact that the disinvested neighborhoods that are not getting the bicycle lanes or not getting some of these other services that help bring the city back together, how they're being pushed back to the peripheries to these car-dominated neighborhoods.
I can start with Washington,
Go ahead.
Washington D.C. probably as a case. And there are many dimensions to that. So as you saw with the bike lanes that were built, we don't have the map up now, but they were mainly in the sort of downtown inner city area, and that's where, what you said, where the gentrifying areas are. So bike lanes are definitely geographically associated with the gentrifying areas. And there are very few bike lanes in the areas that are further out and that are poorer further out. So there's one inequity issue, is that the bike lanes are not distributed equally everywhere, and I think the DC Department of Transport is trying to have more bike lanes in more areas. The other argument was that the bike lanes are put in or are built to attract new residents, wealthier residents, that are creating their tax base and are then pushing out other populations. And I think bike lanes have become involved in that, but I do not believe that the bike lanes themselves are causal to that development in Washington, D.C. So if the bike lanes were not there, I do not think that the gentrification of these inner city neighborhoods and the gentrification of these areas would not happen. They're not not happening just because of the bike lanes. The bike lanes may be a symptom of what the city is doing and who the city tries to attract there. And I think the city should rethink some of its approaches to affordable housing and to assuring affordability, because the property values are really increasing dramatically, especially in the inner areas. And now some of it is already starting in the further out areas, so the population is not just spread to the fringes of Washington, D.C., but outside of Washington, D.C. So there are definitely equity issues that have not been properly dealt with. The same is the case with the last slide I showed on Arlington County, where they built all these dense mixed-use neighborhoods around Metrorail. The demand is so high for those areas that affordability is a huge, huge issue, and they have not found a good solution. I mean, one of the best solutions would be to build more of these places and have demand come down so that the price would even out. But that's not possible because this infrastructure is so expensive.
It's there's so much to unpack in your in your question. I just wanted to comment on a few things. Firstly, I don't think I would tag Jane Jacobs with the term Jane Jacobs-like neighborhood. I don't think that's what she advocated, and I really think that she actually would be taken aback at the character of some of the neighborhoods that have some of the physical characters that she advocated for. The second thing is that putting in bike lanes is not an expensive enterprise. What is expensive is this car culture that we have built. So it's really important to understand that although we do associate biking and those kinds of things with richer communities, it's really ironic that that is an issue of, it's a way of reducing government expenditure by having communities that are like that. One of the things that we found was that Mississippi has the highest spending on transportation of any state in the country. And that's because it's the most car-dependent state in the country. So the question is equating car use or this gentrification with these transportation policies, and I think it is an appropriate thing to do because that's what we're seeing. But what we are really seeing is that we're creating places with amenities that attract rich people. The question is, how do we bring some of these benefits to poorer communities without driving out poor people? And that's really the discussion that is needed. It's not just we're not going to do bike lanes because it's going to bring gentrification. We need to change how people can live in these poorer communities without driving them out.
How about one more question?
I have the mic. My name is Karen Jenkins, and I have the very great privilege of serving as the chair of the board of directors of the League of American Bicyclists. This is National Bike Month, so I hope everyone will get on their bike this month in May and continuing. My question, however, is about research, and this really comes back to the question just asked and unpacking the many issues in gentrification. We know that there are many poor people and immigrants on bicycles, but they're invisible. We don't see them. You only have to go to restaurants and look behind the restaurant to see the bike racks or hotels or other establishments where they're working. They're taking the brunt of the accidents because they're riding at night, in dusk and dawn, without helmets, without proper bike education. But there's very little research. So, and my good friend Ralph, who I came to hear today, while the research presented talks about black, white, in terms of who's getting the accident, who's on bikes, where is the research that tells us who's poor, where they are, and where they're riding bikes, which are all over New Brunswick, all over Trenton, all over cities across this country, and in many rural and ex-urban areas. So where is that research?
Well, I think we have to give credit to people like Ralph and Bob, who's sitting back there, to really change the research agenda. 4, 5, 6, 7 years ago, a lot of these issues were not in the mainstream of transportation research. We need much more in that direction. And part of the issue is changing the national culture around research. You can much more easily get monies to research asphalt. And the million different variety of asphalt than about these issues that affect health and safety. And we need to start changing that. And some of it needs to be health monies addressing transportation safety, because we, as a country, we keep falling behind the rest of the developed world in terms of transportation safety, not just for poor people. We are now back to 36,000 people being killed each year. We're up to about 11 per 100,000, compared to countries like the Netherlands, which is a third of the rate in the US. So this is a huge conversation that goes beyond poverty, race, whatever. It's just an issue that we are not really very much concerned with as a nation.
And besides the concern, it's also having the ability to study it. So I serve as the chair of the Transportation Research Board's Committee on Bicycle Transport, and even the interest in bike transport has only just recently really increased. We have this annual meeting where we get papers that we review. In the 1990s, we had 2 papers per year. Now we get 120 each year. So it's really a huge increase. But what bike research is still lacking is a good data source. We know a lot about cars. We count cars everywhere. We focus on cars. We build models for cars. But very few good data sources exist that actually collect data on bicycles or on pedestrians. So increasing that data availability, just having a sense of how many bikes and pedestrians are going by a certain place, finding out who they are, is very difficult. I tried to, for the Washington, D.C. study, we tried to look by race and ethnicity. In the survey for the entire D.C. area, that's 5 million people, there were 400 bike trips in that survey to analyze, made by 100 people. So very, very small data source that you could actually do anything or something with. So we have to do that research, and it's very, very important, but we have to have the data. The same is true for, if you talk about fatalities and injuries, the police reports. We have to go into police reports very often to find out about what happened to cyclists and pedestrians. And cyclists and pedestrians police reports are often very poorly recorded and very poorly classified. We just did that for a studio project with my students in the Foggy Bottom, Farragut North area in Washington, D.C. And we went into these police reports and we tried to find out, we didn't even know where the crashes are. Some of them were classified to be inside of a block, so we didn't know on which street it actually happened. It was not clear if it was a cyclist, if it was a pedestrian. It was not clear who was at fault. It was not clear which direction people were going. So really, really poor data on behavior, on volumes, and on injuries and fatalities. Important research to be done, but we have to get better data.
Yeah, and I just want to add, I didn't talk today about any of the work I do around injury prevention and bicycle injuries and pedestrian injuries, but I will say I also think the type of research we do has to change. And so I think relying on existing data sources with the limitations isn't going to do it. So we just finished some work in Baltimore using more mixed methods where we did a primary data collection. We did a survey online, and then we went out to low-income communities in Baltimore and did focus groups and interviews with individuals to ask about the barriers to cycling, to ask about perceptions, to ask about other behaviors, because we didn't have the existing data to actually answer those important questions that would inform different policy strategies. I sit on the Mayor's Bicycle Advisory Commission, and we are making decisions without data, so we're trying to collect some of those important estimates to try to inform policy.
And as Norman said, this is the beginning of a great discussion, which I would suggest that we continue over lunch. So please join me in thanking our terrific panelists. Thank you.